Welcome to another episode of Rehab Now, brought to you by the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Dank, and Almighty Studios. We have consultant physiotherapist, Dr. Paula Dawson, our rehabilitation medical doctor, and I'm your host, Alicia Taylor. This week we have a special guest with us. Her name is Jacine, and she's a physiotherapist. Welcome, Doc and Jacine.
Hi, guys.
Thank you for having us.
Okay, great, wonderful. So today, she's going to add to our discussion as we're going to be talking about mothers with their special day coming up this weekend. It's all about the mothers. Whoa, yeah. So when a woman's body goes through a pregnancy, there are particular ways in which it can be affected. Don't we all know this? And so mothers and moms-to-be, remember you can ask Dr. Dawson about these concerns through our social media handles. On Instagram, it's Rehab Institute Caribbean, Dr. Paula Dawson, and Alicia Taylor Music. On Facebook, it's the Rehabilitation Institute of the Caribbean, and our website, rehabcaribbean.com. Jacine, I could talk about physiotherapy and pregnancy because I'm a mother. Can you imagine that? Doc is a mother. We have so many mothers out there. And I'm just really excited about this conversation. I want to know.
All right. Well, I mean, pregnancy is a very special time for women.
Talk to me.
And as you said, our body goes through a lot of changes. And it's, you're just expecting a bundle of joy, but you're also just watching your body change.
Yeah.
And you don't know what to do, right? And with these changes that are happening, you might start having pain. So, and then you might find that, the hair so look a little bit out of place. Or something else is happening. You just don't know what to do. And you're like, where can I go? What can I do? Who can I talk to? Right? This is where we come into play. So you can speak to your doctor, who will then refer you to a physical therapist. So this is where I come into play. So you might find that with pregnancy, you have the back pain.
Yeah, man.
Right? You're having your hip pain. Oh, God. When you're sleeping, your hand cramp up, you don't know what's happening. How should I turn?
Your hand cramp up, your foot cramp up.
Cramp up. Right? So this is where we come into play. So we would prescribe exercises. We can tell you about relaxation techniques. We can tell you about things to buy, like braces for your back, anything that you might have.
So me never know about them set me when me pregnant. This was always around. This was always accessible to us.
Always been around, always accessible. But
knowledge
thank
is
God,
power.
right?
Knowledge is power.
Exactly.
Yeah.
So tell me a little bit about the back brace thing.
Okay. So usually now what happens when you're pregnant, belly growing.
Yes.
Then you have the little duck walk and your back kind of sinking.
I can tell you definitely
right.
about that duck walk.
Right. So what's happening with that now, everything's just hanging forward.
Yes.
And then your muscles aren't as strong to be keeping you up.
Yeah.
So then you have a brace. So you can just strap it around you.
Yeah.
Right? And then that just helps to ease it up. I don't know if you've ever seen like a video with a pregnant lady and her husband will come behind her and just lifts up the belly and she just look like so relieved. All that pressure is right. So with that brace, then that's what's gonna happen. So just imagine having somebody constantly cradling under your belly just to keep it up. So that helps to relieve the pain that you're having. Yes. Right. And then sometimes let's think that brace can be a little bit bulky.
Yeah.
So for us, we also have something called kinesia taping. So then that way
You start with the big terms too. Love that. Got it.
From the Rehabilitation Institute of
Man, you and Doc
and the
these
kinesiology
terms.
5 times.
say kinesiology 5 times.
What is the word? Kinesiology.
Katie.
Yeah, we got it.
She loves the
Thanks for the abbreviation. I don't know why not just give it them with the kinesiology. What?
Right, so we can use kinesiology tape, which functions just as skin.
Wait, tape?
Yes, tape.
Doc.
Not skin tape, no. No, not tape.
No, man.
painter's
Doc.
tape.
Doc, tell me about the tape. I don't understand. Taping of my body.
Mm-hmm.
I'm scared. How the tape go? Do you know the
Well,
tape?
the tape is KT tape, kinesiology tape. Jacine is the pro at taping. Actually, we have a group of physical therapists at Rehab Institute of the Caribbean. So the tape is something that you put on the skin. It provides tactile. She don't like the big words, It provides like a feedback. It provides like a feedback, and it kind of helps your body, stimulates your body to the muscles underneath to kind of contract. So the KT tape in itself may not provide the structural support as a brace.
Okay.
Right?
Okay.
So Justine, tell them how the tape works.
So I should say it doesn't provide that support as a brace. But what it does that when we apply the tape to provide that feedback, what happens is that we can either inhibit or we can excite. So we can prevent a muscle from being overexcited, or we can cause it to be excited. So this is where we come in, we do our assessment and say, okay, maybe it's this muscle over here not doing what it's supposed to do. So then we tape it so that it can do what it's supposed to do.
Tactile.
Right.
Tactile is touch.
Yes.
Tactile. Touch.
Tactile.
Okay, so just a quick question. Is this tape aesthetically pleasing? I mean, how the tape look? Where the tape go?
You've seen the tape
right,
before.
exactly.
It can't go under my clothes?
It's definitely under your
Because
clothes.
I'm saying, me just a walk around as a pregnant woman tape up, then somebody must think something wrong.
No, but the tape, it's the same tape you see the athletes use when they're running around their knee. That different color. You can have pink, you can have neon.
Camouflage, anything.
Camouflage, any color.
Yeah, I feel it camouflage, right? Yeah, man.
Remember
tape in a print?
But hold on, camouflage for a brown skin is not green camouflage.
Say. Guys are joking, man. Come on.
But you know what? I would love for us to talk about how all of this come about. And so pregnancy, let's go back to pregnancy before, we're going to continue to the taping. But, with pregnancy, the body produces hormones. It produces hormones to relax the ligaments and to prepare the pelvis for the fetus to come through.
Right.
So there are different hormones. There's one called relaxin, and there are different hormones that the body will produce. So essentially, in the front where you have the pubic symphysis, which is where the pelvic ring, your hip bone, meet in the front, just over your pubis, that actually has to release. And then in the back, you have the sacroiliac joint, whereas another joint, but that has to get relaxed as well, or else it has to be able to provide some level of movement to allow the fetus to come through, especially if the baby head big. It has to provide. So, right. And so, remember, the back, as we had discussed in back pain, the back is supported by a core, the core itself, but the core is like a 5-gallon bucket. The diaphragm, the front muscles, and the muscles that go all the way around from the back to the front, and the pelvic floor. So with the baby down on your pelvic floor, it's weakening the bottom of the bucket, and then with the front of the bucket stretching out with a big gravid abdomen. I have to throw in another big word. Gravid.
Awful. This is all so awful. Sounds terrible.
Right. And so there's a muscle that comes from the back called the transverse abdominis. It comes all the way around.
Yeah, we didn't know that. I knew that. Transverse abdominis.
Transversus.
Yeah, the TA muscle.
Right. And so that opens up in the front.
There's a TA muscle in the voice too,
Is it?
Yeah, man, thyroid.
Oh, look at you.
Yeah, man, me a go on. Yeah. I know my singing muscles. Come on.
Give me a voice now.
No, there we go.
So in the front where that muscle opens up, you get diastasis recti, which is, DR for short, if you want to call it diastasis recti. But not only pregnant women get it, bare belly men get it too.
What do you mean by bare belly men?
Men with big belly get it as well.
There we go, big belly men.
So if you're ever lying on your back and you try to do a crunch and you see a little mountain come up in the middle like a little triangle, that's diastasis recti. So men have it. I know a few men who have it. And women get it.
And babies are
And so that's what we call mommy tummy. Right? And so when that happens, we go to the physical therapist, to help to kind of bring that back. So Jacine was telling you about the taping. Now, in addition to the brace, you have different types of braces. Sometimes you have a SI joint brace, sacroiliac joint brace, because when the pain is down in the SI joint, which is down on your tailbone, just above the tailbone, there's a triangular bone that connects the pelvis, and that is where you have the sacroiliac joint. So you can do a SI joint belt to kind of hold the ring together. But the exercise that you can do, or physical therapist at Rehab East of the Caribbean, verse. Right, Jacine?
Very much so.
So for the transverse abdominis,
The transverse abdominis is what? The mommy tummy?
Okay.
Or is that the muscle we're talking about?
That's a muscle.
Okay.
So diastasis recti is the mommy tummy. Okay. Right. So, usually before you start any exercise or anything, you have to come in and you have to get assessed properly. I know we're in the age you Google everything and you find that we can do this and do that.
Dr. Google.
Right, but not everything that you see is going to be right for you. So it's wise to ensure that you come and get assessed, and then we'll prescribe something for you to do. So as Doc was mentioning, the core is like a 5-gallon bucket, right? So, and she was mentioning, the pelvic floor is at the bottom. And sometimes when the ladies are pregnant, they start to have urinary incontinence as well. So this is where we come into play as well, because when you laugh, you have a little squirt or you cough.
Yes.
Right.
True.
So we help you with that as well. Prescribe exercises for that.
Yes.
Yes, it's the actual thing.
So how people going to know that? Because let me tell you how life go. You get pregnant, you have a child, you raise the child, and then you move on. You possibly have another one. And then life continues. Nobody never tell we, you get pregnant, you have the child, and then you go to the physiotherapist to help you.
Guess what? Let me just put something into that as well. When you get pregnant, you can come to us while you're pregnant. So don't even wait until you have the baby. You have to start before.
Yes.
No, man.
Yes,
and
ma'am.
They never tell we that.
And you know how it's sticky? What happens is that they have the baby and then they say, go again. You know that each time you go again, it can get worse.
No, man.
So your mommy tummy can
talk
get
to
worse.
me. This is where I'm interested.
Yes.
Because I have one child.
Uh-huh.
One. You understand?
For now.
And it sounds exactly one for now. And it sounds like, I'm sorry, it sounds like my husband wants another. So know that I have the, you know what, Lord? So know that I have my mommy tummy and I want to have another child. How am I going to work out? How am I going to work that moment? Because in my mind, let me tell you what I wanted to do. I was thinking I would leave this mommy tummy and have the next child. And then when I have that child, I figure out how to work this mommy tummy. Is that like a good strategy?
No. The strategy is start from now. So I would suggest to you, because let's ask, do you have any back pain or anything like that right now?
Listen to me, back pain the whole of last night. You know what did happen? Can't sleep.
So that
back pain.
Oh no.
it's definitely like a risk for you to have all these things in your pregnancy. So you want to start that up from now. So ladies, it's advisable before you even start to think about going to get pregnant, come and get assessed. Dr. Dawson is awesome with this.
Come true,
She
Doc.
is the right person
And
for
I have
this.
an amazing team at the
Rehabilitation Institute of
the Caribbean.
the Caribbean.
Right. So you come through, you get your assessment done. We will start prescribing exercises for your core. And not just for your core, for your lower body as well. Because a lot of times when persons are having these mommy tummy issues, then they also have pain in their glutes as well.
Listen to
The
me.
glutes, the buttocks.
I'm
Yes.
excited. I want to hear about these exercises during and after pregnancy and then before you go have the next child, but we gotta have to take a break.
Yes.
So when we take the break and come back, we will hear more. Stay with us. Welcome back to Rehab Now. If you are just joining us, we have Dr. Dawson in studio and Jacine Johnson. We're talking about physiotherapy and pregnancy. Before the break, we were talking about back pain. Please, Jacine, just pick up from the back pain because my back still hurt me. 4 years
Oh boy.
into this, after this child born. 4 years. I'm sorry, go ahead.
I think the best person to start with would be Dr. Dawson because she has to refer a patient to us, and I think she's an awesome back care specialist.
Oh boy.
So, Doc, you want to tell her about that, and I will
Of course, I
chime
couldn't
in.
do it without my team. Jacine knows that. So anyway, all right. So when you're pregnant, as I mentioned, the hormones before, it relaxes the ligaments.
Yeah.
And so you have joints in the back. You remember the facet joint, the zygapophyseal joint? Yeah, man, you wrote it down the last time.
Yeah, man, but we're not going to remember it because it's so fancy.
All right, so we have these. So remember, the vertebral bodies are stacked on each other kind of like oxtail, right?
Yes.
And so you get loosening of the stability in the spine. So inherently, the spine needs to be stable for you not to have back pain.
Oh,
right?
really?
And so when you become pregnant, the spine in itself, because of the relaxation of the ligaments between the vertebral bodies, you tend to get a little bit more mobility than you should.
Oh.
And that can cause a lot of discomfort. In addition to that, because the muscles have been kind of stretched out. You know, when you stretch out, you ever stretch out a balloon yet and try to bring it back?
Terrible.
Yeah, you can't bring it back. But
Can't come back.
The best thing though with the muscle is you can muscles with what Jacine is going to tell you can bring back the muscle into its. You can get a 6-pack after pregnancy, you know.
Oh, I believe that. I
think you should try and get it.
I'm going to, you know.
Right.
But you can't talk to me.
Nobody don't. You need to
With
come to the Rehabilitation Institute of the Caribbean.
What would I call it? What am I saying? Name? Rectus abdominis?
Yeah.
Yeah. All right. And so the last thing I want to just mention is a sacroiliac joint. And so what we do is we do spine stabilization. Jacine Johnson from the Rehabilitation Institute will tell you about that. And the SI joint. And SI joint, guys, means sacroiliac joint. It's the joint between the sacrum and the iliac crest. That's in the back. So, you know, if you touch your back, you feel that little, we call it the natal cleft, that I can't say butt crack on air, but the natal, the natal cleft. It's called natal cleft. It's the cleft between the two glutes muscles. That's the natal cleft. And so right there you have the sacral bone. So right.
Very clear, very vivid. Thank you.
Yes. You're welcome.
But what else causes the pain or back pain?
All right. So as I was telling you before the break as well, if you have back pain before pregnancy, then you're more than likely going to be having back pain during your pregnancy.
Yes, it gets worse.
Right. So like with SIJ joint as well, what happens, you know, between the two little dimples above, right, that everybody loves to look at. Don't
I thought it was just like you went to specific persons, but everybody have dimples. All right, continue.
No, some people are more defined. Right. Yes, some people are blessed with that. So what is happening between those two little areas and just above that little area that mentioned, right? That's usually, you know,
the area.
Yeah. So what happens is that usually people tend to have pain just on one side, right? But it can happen on both sides. And sometimes the SIJ pain might present as sciatica. You know, you might have the shooting pain on the leg, you're having a burning sensation or dull pain. So this is why you definitely need to get assessed by a doctor first. You don't want to assume you have sciatica or whatever it is.
Got it.
So then get assessed, you come in, you speak to your therapist. So what happens now with the laxity that you're having in the joint, because it's supposed to be nice and taut enough, right? So when you're pregnant now, everything starts to loosen up a little bit. So imagine something that's supposed to be tight and not having that much movement start to move around. Things happening that's not supposed to be happening. So usually what we try to do now, we prescribe stabilization exercises, just just help to just tighten you up and keep you going. And then also what happens is that you're having, remember I was telling you about that little duck walk?
Yes.
Right. So what's happening is that now your glutes are working extra hard just try to stabilize you, right? So you're having a lot of muscle spasm around there as well. So muscle spasm going to cause pain. So that's where we come in as well. We try to relax you, we try to massage you, we try to stretch you, but also when you're pregnant, you don't want to do too much stretching. You don't want to stretch all the muscles.
But how do I know what is too much?
Okay.
Because somebody else has to do the stretching for me, or I can do some of the stretching myself.
All right, no, man. We are going to show you what you can do for yourself as well, and can also teach your partner as well, just to help you, because we're not going to be there all the time just to help you.
Part.
Right, we have to
teach
bring in
my partner. Yes,
but if you don't have a partner,
yes,
you can. Where there's still things we can teach you.
Right, you're going to have stretches that you're going to do for yourself as well.
Okay.
Yeah.
Good. So, can you talk about some of those stretches?
Yeah, sure, definitely. But remember, guys, you have to have this prescribed by your medical professional.
Yes. Don't do anything that you hear on this show until you're cleared.
Right. So
true. Nobody go stretch. Pregnant women, come on.
Yes, please. So usually, we like to, believe it or not, we like to stretch your chest area as well, because you have a change of posture, right? Because everything is not hanging forward, so you kind of just start to hunch forward. We like to just open up that chest wall, get you upright, give that belly a little lift and support that you need. We don't want to stretch your hamstrings too much, because those are also connected to your glutes. Those are already firing overtime. So we don't want to be relaxing those hamstrings a little bit too much, but then we also want to be stretching, your abductors in the hips, things that you
opening the legs.
Opening the legs. Those need to you can imagine need to be loosened up for when you're ready.
Does that actually help you during labor?
It
The
does.
stretching.
Good point, Alicia.
Thank you for asking.
No problem. You know, I was very active when I was pregnant, contrary to what you all may believe. I was on stage performing up until the Saturday before I gave birth. Yes, man.
And how was labor for you?
Quite simple.
Exactly.
Excellent.
You know what? That's
Excellent.
because you were active.
Labored for 8 hours.
Really?
Yeah, man, but 7.5 hours was easy.
Wow.
It was the last half hour that I thought I was going to die. But yes, but he came out real quickly.
Exactly. And
Yes.
this is because you were active enough. You know?
Interesting.
Right.
Another thing you want to talk about are the people who had C-section, right? Because like myself, so I had no interest in pushing. I told my doctor, no, I'm dead serious. I don't think having to push makes you a woman more than... You know, so I told
agree
my,
with that.
I ordered the C-section. I said, listen, I have no interest. 38 weeks. Anyway, but the thing is, when you cut, it hurts more. So now you have an incision across your abdominal muscles, which creates a weaker anterior aspect of your core. And so that's even more exercise for you to do. So you have pain from the incision, pain from the back. Imagine carrying a backpack on your belly, a heavy backpack for not 9 months. After 6 months, it gets heavy, something heavy. So your back, as Jacine just said, your back is now having to contract more to prevent you from bending over forward. And so C-section has, in addition to the back pain, the pain that may come from the incision. And now you definitely have to strengthen your rectus abdominis and the other anterior abdominal muscle, because you would have cut through that to get to the uterus, which is deep in the pelvis.
Right.
You know, there's a particular exercise that I'm told, you would all have to correct me, helps to give you a six-pack as after you give birth. Do them name sit-ups? You do those crunches?
Yes.
But I don't know. Them work?
They do, but you have to be careful.
Tell me. Yeah, man. Tell me.
So with the diastasis recti, which is the open transversus abdominis muscle, all right, so that mound that you see when you do a sit-up, you have to close that first, because if you do crunches before that's closed, it will make it worse.
No. Close it open.
No, you can't. It's two muscles that are separated.
Yeah, because the split opening.
The linear
No. What is
So
gosh?
the linear alba, which is the connective tissue between the two muscles in the front, the muscles are separated. And
What separate the muscle inside? What has separated it?
the belly. It stretch it out. Or the beer belly if you're a man.
My God. Wait, so it was together before?
Yes.
And then it separates.
Yes.
To make space for a little bundle. Yeah.
Or you close it up.
Or the beer belly. Although this is Mother's Day, men have it too.
Alright, but where you close it back?
Right.
It can close up?
So the question you were asking, so if you do crunches without, you have to stabilize first. And Jacine will tell you about the recruiting your transverse abdominis, where you have to pull that muscle in before you do your crunches.
Yeah.
Jacine.
So, other times, this is where we like to start with isometric stuff. So, things that are more like just contracting, contracting the muscles without moving it. So, it's like tucking your tummy in.
Yeah, man.
Yeah.
I do the tucking.
Yes. Ladies walk and tuck. It really helps.
Say that again.
Thank you.
Ladies walk
It
and tuck.
really helps.
It really helps.
Yeah, I like
so,
that.
it's, doing a lot of isometric work first.
Okay.
Especially if you had done a C-section as well.
Yeah.
You're not going to imagine you want to be doing a lot of movement like that. You want to be doing a lot of isometric work. So, you're contracting the muscle, like you're tucking in the tummy,
Pulling
you're
your
squeezing,
belly.
you hold. So, you think you're pulling your navel to your spine. You're
Right.
squeezing and you're holding for like 10 seconds or how so many seconds you're...
So Jacine actually treated me once, right? And she told, yeah, man, I have back pain too, but no more back pain because I've been treated at the Rehab Institute of
I'm
Caribbean.
going to get treated at the Rehab Institute of Caribbean.
So-
Don't worry about me.
So one of the things she told me to do was to lie on my back, bend my knees, and she said, pull your tummy like you're pulling it to the bed. Or even when I'm driving in traffic, I pull it in and pushing it to the back of my car seat. So she'll continue. I just had to say that because she taught me that.
Yeah, it's very important that you need to always be contracted. Even right now.
I'm always
I hope
contracting.
you are.
I'm always on that. You know what I'm
Okay.
saying?
Ladies talk.
Ladies talk. But a quick question. So how soon after pregnancy or giving birth can you start to do the contractions and the isometric? What did we name?
Yeah, isometric exercise.
Man,
Good
the
girl.
isometric
You're
exercise.
listening. You were doing
Thank
a good
you.
job.
Thank you so much. How soon after?
Usually right after.
Right.
No, sorry.
The only thing sometimes is right.
Unless it's contraindicated by your doctor.
Right.
But
So sometimes it's not, especially with C-section, because you want the incision to heal first. You
We
don't want to be
understand the
pulling,
C-section.
right? Because you might get an ugly scar.
Yeah.
So you allow that to heal first, right? So you can get a nice thin line.
Ooh, because some C-section mummies, you can't even tell it.
Yes.
Exactly.
Yes.
And they also have scar massage, which we would teach you as well, because that's a thing. Because if the scar heals very tightly, you're going to have pain.
I have part two for this man because this nice. This nice like rice.
Yes,
Rice
girl.
nice?
Yeah, man, rice is very nice,
I
dog.
like
With enough
banana, green
butter.
banana. Rice and
Banana.
butter. Anchor butter.
Anchor butter is really good with
Oh,
it.
we're giving anchor.
Sorry, butter
Yeah,
is good
butter.
with rice and the banana.
Right. So,
Yes, yes.
I've had patients referred by Dr. Dawson who had back pain. I was like, you just had a baby, or you had baby years ago. But I read said had a scar, and when I feel the scar, it's so taut. Once I taught them how to just massage that scar area.
Taut meaning tight.
Thanks.
T-A-U-T.
I got that but some.
Right.
And then you have the other taut, T-A-U-G. She taught them how to release the taut.
Taut but tight.
Right, and that really helps as well. So it's a whole lot of things that we can do to help you
Yes.
during and
is
after
amazing.
pregnancy and before. Yeah.
And this can be like a week after, 6 weeks after, because them tell you for rest like for the 6 weeks after you have
Right.
baby. So it can
Right.
start 6 weeks after. I just want a
yes,
time.
definitely, as long as you start.
Each person is
Okay,
different.
each- That's
true.
Everybody's technique or everybody's prescription is going to be different. And interestingly, sometimes just after delivery, your muscles may not even remember how to contract. You'll be trying to contract and you're like, and nothing happened because it's stretched out.
Wow,
You understand? You ever try carry a heavy bag for a long, long time and you try to bend your elbow, you can't really bend it?
Yeah.
So you're stretching your belly for 9 months.
Oh, wow. Gosh.
But it comes back.
Man, this is amazing stuff. You hear that, mothers? There is hope for us all. But all right, so the time is going, but I really want one.
Pelvic floor, we have to mention Kegel exercise.
Yes, please. Just like what's like, ladies, talk. Always talk. Let's always do your Kegel exercises. So usually now Kegel exercises are for your pelvic floor. So an easy way to know if you're doing it properly, I like to tell a person just to cup your hand and sit on it. When you cup your hand and sit on it, then you try to just squeeze and contract your legs. And if you're feeling the movement on there, you're doing it properly.
Right.
So it's very good for you
So-
to help with the incontinence, everything.
Right. So we kind of guide as well to say, like Kegel exercise, when you're passing urine, you stop the urine. And then let the urine go and stop the urine. That's kind of a Kegel. Because the muscles of the pelvic floor will stop you from urinating because those are voluntary muscles. So that is how you teach them. And similarly, like, if you want to use the bathroom to do a number 2 and you hold it, that's also
a form of Kegel.
And then women, we teach them to kind of tighten the muscle of the vagina, because it's a medical term. So you tighten that, you tighten the anterior part, which is the urinary tract, and the posterior part, which is the back, which is the rectum through which you pass stool. So that will cover your entire pelvic floor. And then what Jacine says, so you just tighten, like you tighten, you feel yourself raise up in the chair, that's your glutes as well.
Oh my gosh. I'm so sorry. This is so amazing. This is wonderful stuff. I can't believe it's the time finish. Thank you so much, Dr. Dawson, Jacine Johnson. Mothers, there is hope for us when we have the baby and even when we're carrying the baby. Thank you for everyone for listening. Thank you to our studio engineers. Thanks to Power 106, our show producers, Renee, Stacy, and Jeff. Next week, we will have a very interesting and informative topic for you. So stay tuned with us. Check out the Rehabilitation Institute of the Caribbean, located at Suite 2A to C, Legony Post Mall. Thank you also to our sponsors, Winchester MRI, Immune Active Denk, and Almighty Studios. Thank you,
guys.
and
Blessings.
blessings.